Welcome to the Wellness Connection with Dr. McMinn. Dr. McMinn is Birmingham's wellness doctor, practicing cutting-edge, world-class wellness medicine at McMinn Clinic in Homewood, Alabama. Each week, Dr. McMinn interviews experts in the field of integrative wellness medicine. The Wellness Connection brings you the information you need to optimize your health in mind, body, and spirit. And now, here's Dr. McMinn.
Good morning and welcome once again to the Wellness Connection with Dr. McMinn. This is Dr. James McMinn. I'm here as usual with our moderator, Misty Walraven. Good morning, Misty.
Good morning, Dr. McMinn.
How are you doing today?
I'm doing great. Thanks for asking.
Wonderful, wonderful. So, Misty and I come to you every Saturday morning and bring you the latest in the field of integrative medicine. Our goal is to empower you to be the best you can be in mind, body, and spirit. Well, Misty, who do we have with us today?
We have Sophia Law. She is a doctor of osteopathic medicine at Fagan Sports Medicine in Homewood.
Wonderful. Well, welcome, Sophia.
Good morning.
Thank you so much for coming on the show today.
Thanks for the invite.
Great. Well, Sophia, I preach exercise every day in the office.
Yes,
in fact,
he does.
I have a nickname for all these little things I do, and I call exercise the most powerful medicine on earth. Nothing can touch it. And you can name any drug, any surgery, anything, and nothing can touch exercise. Right?
I absolutely agree.
Wonderful, wonderful. Well, we're going to talk all about exercise. We have a lot of great questions for Sophia. But before we get going, let me tell you just a little bit about myself. I have an integrative medical practice in Homewood, Alabama called McMinn Clinic, where we practice world-class integrative medicine. I am a residency-trained and board-certified MD physician. I'm also currently on faculty at the UAB School of Medicine. All right, Sophia, well, let's get going. So you are a specialist in sports medicine, is that right?
That's correct.
Well, tell us about sports medicine.
Sports medicine is a subspecialty. There's two avenues in which you can be a sports medicine doctor. One can be in the area of orthopedic surgery, and the other is in primary care. If you come from primary care, you would come from a residency training of either emergency medicine, internal medicine, family practice, pediatrics, or physical medicine and rehab, which is where my background is. So that was my residency, and then I did a fellowship in sports medicine, which can be 1 to 2 years long.
Now, it seems to me like most orthopedic issues are not surgical issues. Is that right?
That's correct.
Right.
Many of them are not.
Yeah, exactly. So we have those sprains and strains, and I know I'm getting to be an older weekend warrior athlete, and so those are the kind of people that would come see you, right?
Absolutely.
Right.
Not every sports injury requires surgery, and so oftentimes you can see us first. If you do need surgery will refer you on to the surgeon. If you don't, it's something that we can probably handle in our office.
Wonderful. And so it's also for things that, like for instance, we talked about cheerleading or dancing, those kind of other activities which would lead to musculoskeletal type injuries, right?
That's correct.
Okay,
really anything musculoskeletal can fall within our realm. Sprains, strains, chronic injuries, overuse injuries. If someone sprains their ankle stepping off a curb, that's still considered a musculoskeletal injury, and whether it's an athlete or someone who's not an athlete just stepping off the curb, it's still a sprained ankle.
Right. So I know a lot of people out there love sports, and like especially for the kids, and they're wanting to get into some kind of sports-related field. How does a kid become a sports medicine doctor like you?
First, you have to do really well in undergrad,
Pay attention.
and then you have to really want to be a doctor and work and know that you're going to work hard for a lot of years. You then apply to medical school, go to medical school, and at that point you do residency, and it can be in one of these 5 areas, these 5 disciplines that I just listed, or orthopedics.
Yes.
After you complete your residency, if you want to go on and do further training, then you can do a fellowship in sports medicine.
You know. Well, I know you work for Fagan Sports Medicine right there in Homewood, just right up the hall from me. But anyway, of course, I know Dr. Fagan. She's a fabulous physician. I've known her for many, many years. And you guys make a dynamic duo, the two of you.
Thank you so much.
I'm so glad you guys landed together. And I think that there's nobody in town who can touch you as far as sports medicine.
Thank you so much. And it's actually nice that we both come from different backgrounds.
Right.
She's an MD, and her background is internal medicine. I'm a DO, or osteopathic physician, and I come from physical medicine and rehab. So we come from 2 slightly different backgrounds, but we're both fellowship trained in sports medicine.
So you've got all the bases covered, don't you?
We think so.
Okay, great. So, for instance, what would be a typical type of injury that you would see on a daily basis?
Wow, we see lots of sprains and strains. We do also see simple fractures, and we do see some chronic overuse injuries, especially with our runners.
So what are some of the modalities you use?
We will oftentimes prescribe physical therapy. We can also give injections, joint injections. We do now have a new musculoskeletal ultrasound machine that we are using more and more frequently, which allows us to evaluate a musculoskeletal part of the body real time right there in the office. The patient watches the screen at the same time we're watching it, and we're describing what we're seeing on the screen.
So is the ultrasound simply for diagnostic purposes, or is there some therapeutic purpose as well?
Well, there's therapeutic purposes from the physical therapy standpoint, but from our standpoint, we use it for two purposes. One, we can use it for diagnosis, just as you're saying, and that, in our case, may save the patient the step of an MRI, might be something in addition to an X-ray. But we also can use it for guidance when we're doing our injections.
You know, I'm thinking of a specific patient you may recall I sent to you just recently, and she had been to her orthopedic surgeon, and I love orthopedic surgeons, don't get me wrong, but he said, oh, you need surgery. And so I sent her, let's get a second opinion. I sent her to you, and you sent her to a wonderful physical therapist. You can name names if you like, physical therapist. Who was that she went to? Shoulder injury?
Yes, Leslie Shamp at Therapy South in Vestavia.
Exactly.
And Leslie loves the shoulder.
And she went to see Leslie, and wow, she's had great results. She's doing fantastic with a non-surgical approach. So thank you very much.
You're very welcome.
She's a patient I happen to like very much.
And you know, there's a lot of people out there that are afraid of surgery, that don't want surgery, that really want to make sure they've explored all their conservative options first. And we really try to work with them to make sure that they've tried all conservative aspects before surgery may become an option.
Well, I'd like to move on to the topic of exercise as medicine. Sophie, we've talked about this before, and this is something near and dear to my heart. Once again, I preach this all day long. And but anyway, tell us your thoughts on exercise as medicine.
Well, that is actually something I preach all day long too, so I'm glad we're on the same page there. This is an initiative that has been started by the American College of Sports Medicine, and the idea is that, yes, it's good for the medical community to preach and to say on every visit it's important to exercise, but then what happens when that patient leaves your clinic? Do they actually go out and exercise? Or do they just go on with their day and do the same thing they did the day before? And so what we've done is we've asked for the help of the fitness community. And what exercise as medicine does is it marries the medical community and the fitness community in an effort to help our community at large exercise.
Well, that's wonderful. Yeah, you're connecting the dots there. We do actually something interesting in our office as well. We have a program called the Accountability Program, and Misty runs that for us. And so I actually will have an exercise prescription for patients, and I have them report in every single week. And if they don't report in, we go after them. Because I just feel, as you're saying, that it does it just like whether it be a medicine. You know, if I write a prescription for a drug, it doesn't do any good if the patient doesn't take the prescription. And the same thing with the exercise.
That's right. And we do this just as if I was writing out a physical therapy prescription or a prescription for medication. If I'm writing a prescription to the pharmacy, I'm giving the patient's name, the phone number, the demographics, and if that patient doesn't show up at the pharmacy is going to call them. So in the same situation here, if I write an exercise prescription, which I do often, I'm sending that prescription to possibly one of the local gyms with the okay of the patient. I'm also asking for permission that if they don't call or if they don't show up, that the fitness facility can call them back and see what kind of support they need to actually get started.
I find that when they're accountable like that, it makes them want to do it more because they know they have to answer to you.
That's right.
That's right.
Oh, it's
of course,
huge.
I beat them up. No,
That's right. Accountability is huge. You know, and I think just I have found just the act of reporting in changes behavior.
Exactly.
And it's all about changing behavior. So, you know, so many of us don't get enough exercise, but what about those on the other end of the scale that get too much exercise? And Sophie, I'm looking at you. You just came in, off your bike or whatever? So
I just came in for my Wednesday night run.
Yeah, so this is like the pot calling the kettle black here in Sophia. But having said that, what about those that get too much exercise? Is there such a thing?
There is such a thing. You know, there's always people that fall on one end of the spectrum or the other. And there's those that get almost no exercise. There's a majority of us that do something, but then there also are those that can exercise too much, and that can be in two areas, in intensity and in frequency, and sometimes in both. And both can be dangerous. Your body needs its time to rest. So if you exercise, it's just as important to nourish your body, to hydrate your body, and to get the rest that it needs.
You know, one thing that fascinates me is that concept, don't they call it the female athlete triad?
Yes.
Tell us about that, please.
The female athlete triad is composed of 3 issues. One is disordered eating, and that's typically what starts the process. And disordered eating means that they don't necessarily have an eating disorder diagnosis, but they may be starting in that direction, within that spectrum.
Mm-hmm.
Also, we see that these patients can have issues, typically, they're females, they can have issues with their periods.
Yes.
And they may stop having their period. And then the third area of concern is their bone health. The girls' regularity of their menstrual cycle has estrogen surge monthly, regularly, and bone strength needs regular estrogen.
Mm.
It works differently in boys, but with girls that can be a real issue. And so those three things, disordered eating, bone issues which can lead to osteoporosis, and problems with their periods which can lead to not having their period, that combination of those three can lead someone to the female athlete triad. Now, believe it or not, there is a male category of that.
Mm.
So there are guys that are not eating the proper amount or exercising too much, and they're also can be affecting their bone strength.
Mm-hmm.